It's Suicide Prevention Month. Thank you for joining episode 3 of Mind in Minutes. Today, what mental health struggles are most linked to suicide, warning signs, safety planning, and how you can help. According to Psychology Today, many mental health disorders, including depression, bipolar disorder, borderline personality disorder, and PTSD, significantly raise suicide risk. Wikipedia notes that half of all people who die by suicide may have a mood disorder, and about 5% of those with schizophrenia do, while conditions like personality disorders and psychosis are also common. Globally, mental health or substance use disorders are linked to approximately 80% of suicide deaths in high-income countries. Wikipedia's suicide prevention page lists warning behaviors like talking about wanting to die, social withdrawal, mood swings, hopelessness, and recklessness as red flags. SAMHSA emphasizes that untreated mental illness and substance misuse are major risk factors, while protective factors include coping skills, self-esteem, and social support. According to JAMA Psychiatry, the Stanley Brown Safety Planning Intervention helps at-risk individuals by creating a crisis plan and is shown to reduce suicidal behavior. Research also shows safety planning interventions are effective in reducing suicidal ideation, attempts, and deaths by offering distraction strategies, reminders of connections, and coping tools. SAMHSA advises that reducing access to lethal means, staying empathetic, encouraging professional treatment, and helping create or review a safety plan are key actions. So if you're worried about someone or yourself, remember, these are the risks, these are the signs, and these are the steps that help. If you're in crisis, call 988 or text HOME to 741741. Please like, share, or comment one thing you'll do to support someone, and subscribe, because few minutes can change lives.